You are watching Access LaPorte County Channel 97. Coming up next is the December 11th meeting for the Michigan City Common Council Workshop. You can find more information for this meeting by visiting www.accesslaportecounty.org.
Thank you very much. I want to welcome all of you. I appreciate you being here. I know it's a busy time of the year with the holidays, but this is a very important issue that we are trying to address. And this was brought to our attention at one of our city council meetings. I want to recognize the members of the Public Health and Safety Committee. We have Councilman Moldenar here and Councilman Lee, who has just joined us. And I also want to thank Councilman Don Przybylski, because he is extremely interested in this area, and also Councilman Greg Coulter. So he'll be joining us too. And I want to recognize Councilman Tim Bietri, and our mayor is here. The problem of homelessness is not unique to our community. It is there all over the country. And as a matter of fact, when I was looking at the statistics, there are about 770,000 homeless in the entire United States. It comes to about 0.25% of our population. So it's a huge problem. It is not unique to our community, but at the same time, it's a problem that we as a community need to come together and address it. And it needs to be addressed with the compassion and the humanity it deserves, but at the same time, make sure that we keep our city safe and clean. And so these are some of the tough issues that we have to deal with when we are addressing this problem. I know there are several of you in this audience who have been dealing with this problem for a long time, and I'm very grateful to all of you for being here this evening. I know the mayor has had some initiatives that she has been involved with. But before I do that, I wanted to ask my fellow council members if they wanted to have any opening remarks. Councilwoman Moldenar.
Thank you for warning me about this. This really is a significant and serious problem, as Dr. Gora stated, for the whole country, and especially for Michigan City. We're one of the few communities who have as many homeless shelters and services, much more than any of the surrounding communities around us. So this means that a lot of our unhoused individuals actually come to Michigan City to receive services here. So I want to acknowledge the heavier than usual client load that we have. Also, I want to clarify something. I think there was a misunderstanding that only once a year we go out and survey our homeless population to find out how many there are. This is an effort that happens wintertime, once a year, and this is a combination of the Michigan City Police Department and many of our nonprofit organizations, that they go out looking for those individuals who usually do not utilize the services that are available. So we want to know about them. They're an important part of the total population who are unhoused in our community, and they're not just going out and counting, they're having conversations with these individuals to find out what types of services they're looking for, and also why they don't utilize the services that are available here. So I want to put that out there. I know that all of our service organizations are keeping statistics of how many they're serving, the results of that service. If they weren't doing this, none of them would be able to get grants, because that's a basic requirement of any grant that a non-for-profit organization is submitting. So I guess that's what I had to say. I know that all of us have big hearts in our community, and we are concerned about people who are on the down and out. And many times with a little bit of help, a lot of them are able to find a home again, get work, and, become productive citizens in our community or whatever community they decide that they want to live in from that point forward. Quite frankly, all of us, most of us, I'll just say most of us are simply 1 or 2 paychecks away from becoming homeless ourselves. So that's the reality of the situation. Thank you, Dr. Cora.
Thank you. Councilman Prisbinski.
Thank you, Dr. Cora. Welcome, everybody. I'm glad that we could have this workshop. I know that Michigan City provides a lot of services for homeless and people down on their luck, and that's great. But now that we provide all these services, other communities don't, then we have to deal with what we have to deal with, and that's people coming to Michigan City to get these services. I know that, and I may be wrong by a little bit, but there's a lot of people that don't live in this community that are able to get these services, and that's what keeps people coming here. So now that they're coming here, we have to manage what I call the problem of people loitering, people, urinating, defecating, and on storefronts, people panhandling throughout the community. Whether you think that's okay or not, I don't particularly care for it. And I will stand till the end to make our city clean, presentable, and however we have to manage these homeless folks in the right way, whether it's a mental problem they have, then if we have to look into providing some kind of services or to get these people to get the services, then that's what we need to do, because that's the state we're in right now. So let me bring up an example. And it's nothing I found. It was by a gentleman named Tom, and he was walking around the area from 11th Street down to Barker Ave and back up. So where the rodeo bar used to be, he saw me one day and he met me there. We looked at it, the parking lot. It was a total disaster. There was clothes there. There was feces there. There was trash there. And it was very embarrassing to Michigan City, embarrassing to me to be a city councilman, to see this going on right underneath our nose, right underneath the $10 million development that was sitting 100 yards away. And we either didn't know about it or we turned our back to it. But to me, these are the things that are going on around the city, and they have to be dealt with. They have to be dealt with all of us. Whether you run the Keys to Hopes, whether you run the Nest, or what other non-for-profit you run, you have to get in the game and help the city clean this issue up and get it taken care of. Thank you.
Thank you very much. Councilman Lee.
Thank you, Dr. Cora. Thank you all for being here. I'm here tonight to learn and to listen to all of you and to figure out how we can all work together to fix some issues that we have and to make a more productive city and where we can all be happy and coexist and do what we need to do for each other.
Thank you very much. When I go around, I have heard people voice their concerns about some of the things that Councilman Prisbinski had mentioned. But at the same time, a lot of people also want to make sure that people are taken care of. And I also have heard that they want to take care of the folks who are from Michigan City, but they also don't want to take the burden of other communities. So these are various things that I hear from the constituents. And at the same time, we don't have unending amount of resources as a city, because especially with what has happened at the state level with the cuts in funding for the counties and the cities and everything. So that's a challenging aspect of this whole problem. And then there are a lot of you here who are part of nonprofit organizations who tirelessly work to make sure that these individuals are cared for, and for which we are extremely grateful. With that, I'm going to turn it over to Mayor Angie for her remarks. Mayor, can you want to just summarize what you have been, because you have been working hard at this, and that way I wanted everybody to know what has already been done and what else needs to be done.
Good evening, everybody. So I know that Kelly presented at the council meeting, and I encourage you to take a look at what Bloomington is doing. We've been working. Mayor Carey with Bloomington has been bringing all of us mayors together because the city of Bloomington actually was having probably exponentially worse situation than Michigan City. And of course, they're bigger. But she just released their findings, and she's been working with several of us mayors. I think 30 of us have been coming together to talk about, what we could do differently. And there's several pieces of that. And we talk about funding. We do have CDBG funds that support our homeless shelters already. We also worked on a grant for a street team. And really what we were looking at is how can we take case management to these places where we have encampments or people who are loitering and people who are working, or people who are not working but just walking around our town, and what does that look like? I know that several months ago we talked about this respite home that was going to be along the way, right? And how that impact of people walking from the west side to Keys to Hope to whoever. We actually convened in this chamber prior to those comments on Facebook. We brought all of these organizations together, and we started talking through, some of the things. I know that we have some things that we're looking at, but I do want to point out a couple of things that was very pertinent in what Mayor Carey has shared with us. Reconnecting people to their families is probably one of the most important things, because what you'll find is you'll have a high percentage of those people who are not from the area or not from this county or this city. And what can we do? Part of the grant that we wrote was, how do we get them back to their families and get them transported back? And then with our police department, we've talked about maybe there's a way for us to employ them in some type of bartering system where we could provide them, housing for a short period of time, and they could do some things around cleanups and things like that. But again, that's going to require an action agenda. And that's what we're talking about as far as pulling together a committee that really focuses on that, the services that are provided and what that looks like. It's not something that's a one and done. Yes, Facebook is a medium that is, like we said, we rage bait all the time. And you have those issues, but you have them everywhere. Again, I don't want all of the services provided downtown. I don't think that's what we should be doing. I think, I know when I first moved back to Michigan City, one of the things was it got shot down. Someone tried to build a brand new homeless shelter, and it got shot down in the early 2000s. So now we've gone to this model of this overnight men's shelter. Well, as we've stated multiple times, we're one of the only ones for single men in the region. So yes, you're going to find that more people are coming here. I don't want to be the welcoming arm for everybody in the region to come to Michigan City. Just don't. I understand what's happening, but again, I think what I don't want to happen is, people are really looking at how they're funding nonprofits now, because you got businesses and organizations who don't want it either, right? So, that could impact them financially in the future. It's just what it is. And there's been talks, and I've heard those rumblings amongst funding agencies that, hey, maybe we shouldn't be funding certain things and maybe this problem will go away. And I'm like, no, it probably won't. So we have to be very, very strategic in sitting down. We can sit here and talk about it until we sit in a room and get someone in there to work us through a strategic planning process, which is the next step. Uh, we're going to continue to do this. And this is fine. But as I said, we're putting together a committee to speak on that. And it has to be the service providers who are here talking about it. So I'm glad you decided to do this. Like I said, we've brought them all in here already and had that, but I know you want to do something for the public. But as far as I'm concerned, we're going to continue to move forward with our plan for the city and utilize CDBG funding and our housing dollars with the ARPA to continue down that process. But also understand employment is a piece of that. Mental health is another piece of that. And that's where our opioid dollars will come into play too, because with our social worker, Jocelyn, these encampments that we're looking at, and we've gotten several of the owners of those properties to sign for us to be able to go on site and handle those situations. So we proactively reached out to those places to make sure we can go and trespass people because we don't want fires and we don't want safety issues either in those woods around town. So there's so many different things. I could probably sit up here and talk for another 15 minutes, but just know that the next step is to form an action agenda. I encourage you go to Indiana Bloomington's website. They have a resource page, and I shared that with Kelly on their website, where it shares all the resources that are available for housing, for food, for all those different things, which includes the housing authority as well. So I think we can do those things proactively, but I still believe that we're going to have to put some funds to it and have someone come in and walk us through creating our own action agenda around homelessness.
Mayor, a couple of questions I have for you. One is, when you form this committee, maybe you can involve one of the council members and then we'll be part of that committee, because I think like you rightly said, we can have these discussions, but we need to come up with a plan. And then we need to have an action plan, and then we need to start taking some action to address. And I don't think we can solve this problem overnight. It has been years in the making. It's going to take some time. But I think if we can all work together, we can hopefully address this. One of the issues, Mayor, that came up was about personal hygiene. And I was wondering, can we as a city provide a couple of public restrooms or something like that? That way people can utilize those.
So one of the things that Chief Forker talked about, we talked about the hotel stays so that they can take a shower and things like that. We've had public restrooms that were destroyed previously. And so, no, I don't see that. There are public restrooms in different places that are open during the day. I think the issue might be the weekend, some of the weekend hours once they leave the shelter. But I think we still are working on having a dinner with the homeless population. We talked about doing it as Salvation Army and getting input from them directly, not bashing, not being inclusive. Hey, if you're going to be in our city, how are you going to help us keep the city clean? Because there have been instances, and is he in here? Yes, thank you, Mr. Kilborn. There's been instances where you have communities that have self-police themselves. And I think if we have to have the conversation directly with them. Yes, they're providing services, but until we get them all in a room, break bread, have the conversations and saying, hey, if you're a part of this community and you're killing us, man, you're killing us, right? And we need to just be very direct and blunt that, hey, you got to help us help you, right? You can't have you sitting on stoops, walking around, sleeping just on the stoop here. Help us help you be productive, whatever that is, whether it's telemedicine, telehealth, we've been looking at that. The Swanson Center partnering with the Salvation Army to do telehealth, at that facility, because there's so many facets of this.
Yes.
Some of it is mental health. Some of it could be drug
Substance abuse.
So there's so many pieces of that. But then there's just the fact that, hey, I'm just unhoused. Something happened, and now I'm trying to stay at a hotel. A lot of the panhandling, and you can ask some of them, well, I can make more money to get a room and stay at a hotel versus going to a shelter. So I'm panhandling so I could pay for my night stay at the shelter. So we have to really look at the holistic picture of why these things are happening. And again, my suggestion, even with that, don't give people money. We need to come up with our own resource cards. We talked about that. You hand that out to them. Give the money to someone who's going to help them get housed or get off the street, right? So I think there's a little bit of all of that.
So what you're saying is if members of the community want to help somebody, instead of giving them the money, give it to the organizations that will help take care of the problem.
If you provide them money or you provide them blankets and coats, a lot of that stuff ends up on the ground, right? It ends up wet. It may be food that they don't want, and it ends up on the trash, right? And so we don't realize that while we feel good helping, it's a direct impact to city services, because we're assuming they need all these things. And I think that's where we're missing the boat. We need to bring them in to find out what are the needs and why aren't you getting services? Why are you, living on the street or living in an encampment? And I think there are going to be a lot of factors that impact that, but we haven't talked to them. And then the service providers, they can give us some of that information, but just throwing money at things is not the solution without understanding really what the problem is.
Right.
Now, you did say the committee. So the way this is going to work, you'll all be invited, and it won't be a council committee. That way you don't have to worry about a quorum. You can always give your input to the process, but those will be during the day when most service providers are available and working. So you'll all get invited. So that's not a problem.
Right. Thank you. Does anybody have any questions for the mayor? Yeah. Thank you for being here. I know there is an event at the high school this evening. I appreciate everybody who could be here. And if somebody wants to leave early, I thank you very much for coming. The next item I have on the agenda is the role of law enforcement. So Chief Farquhar, you want to come up here, and most of the people I have spoken to understand that this is not a law enforcement problem. We can't treat this as a criminal matter. This is a problem related to providing to helping people get back into by housing, by providing affordable housing. Even if they were to be jailed, what will happen when they come out of it? Again, they'll be homeless, so that's a problem. But having said that, people who have properties they want to have safety, and they also want to make sure that their property is not being encroached upon, and they want it clean. So, Chief, tell us, what can the police do to help that situation?
Yeah. Again, we've talked about panhandling first and foremost, right? That law was repealed back in 2020, right? So there's no panhandling law. There's no law against panhandling. So again, that was repealed. So that's, for simply asking for money, right? We can't arrest on that, right? Some things that we have been doing, right? City ordinance wise, right? There's some ordinance against it, and there's some safety concerns when you see the panhandling in the roadways, right? So whether that's on the curb, right? The center turn curb, we've seen that in town. So obviously we've worked to remove individuals from panhandling in the roadway, right? That obviously is a safety concern, and those things can be addressed, right? Aggressive panhandling or aggressive harassment, mind you, right, is another other incidents where somebody ultimately, I guess, could be arrested for, right? If there was a victim in which they felt, right, they were aggressively harassed, we could follow through with those avenues there. Trespassing, again, is another one like Mayor alluded to. We've been working with some of these, essentially creating a database, right, for property owners and whatnot, in which, they're essentially setting up encampments on private property, right? Again, those are incidences in which we need that victim to say, hey, we don't want them there, right? They did pass a law here July 1 in 25, in which property owners can sign off essentially saying, hey, yeah, we want the police to act as an agent of ours, saying we don't want, unless they're an employee with an ID, please remove them from our property, issuing them a trespass warning. So we do have that, like essentially a letter in place in which business officials could, or business owners could come to the police station and say, hey, we don't want anybody that's not, an employee there after hours, or, whatever, those circumstances are. And so the police could act as an agent of that business and say, hey, yeah, you're trespassing here. It's clear they don't want you here after hours. And, we could act as an agent, again, of the business owner again. And, first we would issue a warning if the subject returned, and then we could arrest for trespassing. Loitering, same thing, right? Again, business owners call us, hey, they're loitering out front. We don't want, that loitering here. Call us. We can obviously remove them. But again, just generally panhandling, that law was repealed back in 2020. So again, we can't simply arrest or enforce, right? Just that panhandling. The mayor did touch on, some ideas, I would say, that, essentially we had that we were working through with the department, working on housing, right? Ultimately to possibly remove individuals, right? Or give them a warm place to stay where they could address some hygiene issues or whatnot. And again, an idea was to, work with some of our local, I would say, one night stay hotels, right? Whether it's, the King's Inn, Red Roof Inn, whoever offers those like one night stays, maybe work with them on possibly, a discounted rate for the city. If individuals were to come work on some of these cleanup initiatives, right? To, whatever it may be, right? Cleaning up trash, helping out in some way, shape, or form. Maybe, we could work to ultimately get them a place to stay for the evening, working again with these housing, I would say hotels or whatnot, to get them a place to stay for the evening. But again, that would have to be some type of continuous effort there. Again, those were just some ideas that we had. And again, as far as homelessness, right, we do obviously have Jocelyn, our social worker, who continually works with our resources through the community, to reach out to these people. What can we do for you? How can we get you out of this predicament, right? Or how can we get you, the help that you need? Unfortunately, oftentimes, this is the norm, right? We on the outside think, there's a problem there, right? There's a crisis there. But, again, in dealing with, some of these unhoused individuals, they think that's the norm, right? This is what they've grown to be accustomed to, and they don't foresee it being a problem. Right. We as maybe society don't see it as the norm, and we feel it's a problem. They think it's the norm and they're okay with it. So again, we try to reach out and do some of these proactive approaches to it, but if they don't want the help, or they don't want the resources, unless they're a danger to themselves or somebody else, we really can't force them to do a lot. So it's just a constant, I think, constant battle where we're always trying to reach out and say, hey, we can offer this, we can give you help. And being there and having, like the mayor said, these resources available, whether it's pamphlets, websites, whatnot, again, we have to find that way to reach out and to continue to, give them the help they need.
Chief, one of the reasons we convened this was we had several individuals who either have businesses in downtown or residences in the downtown area. They were here at a council meeting last month, and they expressed concern about their safety and the sanitary aspects of their surroundings and things like that. So, what can you do to help them?
Yeah, I think obviously, since that we have stepped up like our visible patrols, like foot patrols, getting back to some of, I would say, the old school policing way, right? Getting out, and I would say not so much from a a homeless thing, but more of a business approach, right? Trying to connect with our businesses and get in and out of them, right? Connecting that, that community policing aspect of it, which I think unfortunately, right, we've kind of, through COVID and some of those things, right, we've gotten away from some of those personal touch type policing. So getting back to some of that stuff, right, where we're having those active foot patrols, getting in and out of the businesses, seeing some of the residents there, from I would say what I've seen online, and what I've heard some say, right, the business owners and residents have greatly appreciated that. We're still continuing some of that stuff. I would say it's not as frequent right now, this time of year with the inclement weather, right? We will still continue those, they might not be as many foot patrols, but there's still those, visible patrols, I would say, with vehicles.
Any questions for the chief?
Yeah, Chief, Ruby Woods,
Mhm.
is the department still making checks out there as they said?
Yeah, I would say as they
do
come
at
in,
the last encampment they had, what was that, a couple years ago or a year? Yeah.
Yeah, I mean, I think it's a constant. I think as those calls come in, say, hey, there's another encampment, we do, I don't say we make daily patrols through
Right.
Ruby Woods, but as they're coming in, we're working with Vector and the Parks Department, to, alleviate those encampments that are trying to set up on city properties, right? We're trying to stay in front of those, as we know those are, against ordinance and whatnot. So
Yeah, have you removed any encampments?
not
Ruby
recently.
Woods
Unless
recently?
Vector, I don't think Vector's been out there recently either, so. Yeah, Parks has been out there, right, but, nothing, I would say that's brought to I would say a safety concern that the police would have to be present for.
Okay, great. Thank you, Chief.
Yep.
Thanks for coming.
Thank you.
Mr. Kilborn, are you representing the Swanson Center? Okay. We wanted to address some of the mental health resources issues. You want to step up here? Thank you for being here. One of the things that comes up when we are talking about unhoused individuals, homelessness, is mental health issues and substance abuse issues. Now, if a family member or a community member or a neighbor is concerned and they want to help this individual, how easy is it to get into Swanson Center to help? What can they do? Is there a person there at Swanson Center whom they can reach out and contact? I just wanted to make this a public awareness kind of a pitch as to how we can get them the help they need.
Well, to go through one particular instance a couple of days ago, working with a gentleman who was homeless, needed mental health assistance, and I got him to Swanson Center during open access hours, which is 9 to 4, Tuesday, Wednesday, Thursday. Anybody can walk in, and if you don't have insurance, they'll do presumptive eligibility. So I was able to get this person into Swanson Center, and they have a follow-up appointment, but between now and the follow-up appointment, there's a medication issue. So let's put a Band-Aid on it. As part of Swanson Center, as part of the PATH program at Swanson Center, I was able to refer this person to another place to get their medication in the interim until they get fully into Swanson Center. And Swanson Center is taking some initiative. I think we talked about it before, between Swanson Center and Salvation Army and telehealth. So there's some good things coming down the road that are going to make it even quicker. And what I do as part of PATH, I'm the PATH case manager, and Jennifer is my boss, the PATH coordinator. And we work with different agencies throughout the county, whether it's LaPorte, whether it's here, whether we have to go down to Hanna, Indiana. We go wherever we're needed to intercept and do intakes and assist people however we can. So we kind of flow through the processes of that. And we work with Jocelyn also. We're very grateful to have Jocelyn on our flank. And whatever we can do to assist people. I will tell you that since I had occasion to look this up recently, since January 1st, we have done intakes with 164 people, and 119 of those people had mental health concerns. So it's a really large number in our community, and in the unhoused community, it always has been, but there's less privacy there. So the issues are kind of out in the public. There's violence in the homeless community occasionally, but there's violence in every community occasionally.
Right.
So, what was I going to say? My train of thought gets wrecked because I have ADD. I will say that,
As you're putting your thoughts together, just stay right there.
yeah,
Elizabeth, can you hear us?
Hello, yes, thank you so much.
Yeah. Elizabeth Johnson is a representative from Congressman Mervan's DC office. I invited her to join us this evening. Elizabeth, you have heard this conversation so far. Are there any resources, federal resources, that are available for us, either from the standpoint of homelessness or providing some help for people with mental health problems or substance abuse problems that we can use to help address this situation?
Oh, sure. And first, please, on behalf of Congressman Mervan, thank you so much for sharing with me the Zoom link today and for the opportunity to join you so that we could get a better idea, not only as to the issue, which we've been tracking just through, local news, but also to hear about the coordination efforts that are taking place in Michigan City. I think I would answer your question both generally at first. I would just say generally, yes, there are federal resources. Some of those have been mentioned, CDBG, some of the funding, for example, that I know that Swanson Center accesses, as well as the federally qualified health centers. I believe HealthLink covers Michigan City.
Yeah, it does.
And so, those are just kind of, offhand funds I know that are coming into the city to help directly or indirectly address the issue. I think it was perhaps the mayor's point, where there was the conversation about, having to put together, a strategic plan where there's more identification, I would say, in terms of, the reasons as to why they're homeless. And that's where perhaps having that information would help better define what resources are available. And I say that just because with many federal grants, right, there are, some very specific populations that the grants are authorized to address, and that's all defined as part of the eligible projects. So, I appreciate the opportunity to hear what is being done and kind of future initiatives so that we can continue to work together. And I, as well as the congressman, stand to be a resource here throughout this process.
Elizabeth, what I wanted to ask you was, are there any other grant opportunities that we are not currently utilizing? If you come across anything, please let us know. And also, if there are any private foundations who are in this field of interest where they address problems related to homelessness, and if those grants are available from private foundations or from federal government, just keep us in mind, and if you can pass that information to us.
Absolutely. That is something that I would be more than happy to do on both fronts, from the federal grants as well as private foundations. And also for what it's worth, the congressman does offer letters of support to any community or organization applying for any funding opportunities. So if that is something that the city or some of your nonprofit partners would be interested in, we are happy to do that if again, if there is interest. And I think, and I'm happy to share after the Zoom, I should say, that I can send my contact information around so that it can be shared. And at any time, if there is, a member of the city council, any of the organizations, any of your partners would like to just reach out, ask questions, request a letter of support, you'll have my contact information, and we can work together.
Right. The mayor has a question for you, Elizabeth.
No, not necessarily a question. Elizabeth has helped us. They have written every single grant we submitted. They've provided a letter of support. One of the fiscal projects that has been on the back burner that I check in with her every couple of months on is a resource center that we had for the West Side, an opportunity hub for veteran resources to have our local, CDBG and different organizations to be able to utilize that, whether it's for telehealth training, whatever. Well, it got approved through his office, but it's kind of sat, and then we submitted another one for fiscal year 2026. So it's politics, right? And we've been trying through the federal government to get those resources in. But that's that old police hub on the West Side. We actually applied to amplify that, to make that more vibrant on the West Side, but to provide services for veterans, for unhoused, for all those things were going to be in that facility. We're still waiting, and I check in every couple of months, but they've been very instrumental in keeping us abreast of what's happening and what's going on. But they have written letters of support for every grant that we've submitted to the federal government.
Mayor, one comment I wanted to make is while I was studying about this issue, one area where the homelessness has gone down significantly is among our veterans.
Mm-hmm.
And the reason for that is because the federal government has invested a good amount of resources to make it happen, and it happened.
Mm-hmm.
And so I think we need to make sure that we need to press our federal elected officials to get the resources we need at a local level to make sure that we address the problems like like we have done it in with the veterans. We need to do it with every other demographic.
And the last thing I was sharing with Mr. Kilborn is that as people speak, that especially service providers, if they could share with us where these folks are coming from.
Yeah.
Are they from 46360 or 46350? Where are they from? Are they coming from outside? I've been told multiple times, they said that's not true, but it is true that people are, getting tickets on the train and being dropped off here and all of that. So I've asked them to kind of share that, and if others, as they speak, could share that same information, because 119 or 109, that's a lot of people.
Yes.
That you're seeing, and it's interesting to see for the homeless populations, where are they coming from, specifically, that they're ending up in Michigan City. Are they getting let out of county jail and then coming over here? Are they bouncing around to different places after they've lost their pass to be at a facility? I know we've helped people in our office that bounced around from homeless shelter to homeless shelter, and spent half a day trying to get, two women housed with their kids, only to find out that they've been kicked out of multiple places. So what do you do with that? And, and then only to find out that one of the mothers OD'd, a month later in the hotel. And so that's a lot. That's a burden, right? It's not something that you take lightly, so I think that we know there's an issue, but also the mental health piece of it, because we can try as much as we spent a half a day and resources trying to get them connected, only to find out that they've already used all those resources up. So that is a thing.
But your suggestion of connecting them back to their families, I think it's a very important thing.
Well, it's twofold.
Yeah.
It's a thing of connecting them back to their families, but sometimes the family was the issue that got them into the unhoused population. So there's a lot to unpack. We're not social service providers here at the city. And I think that's where people is conflictive. Well, the city should be offering solutions. I'm not an MSW. I'm not claiming to be. All I know is sometimes I've had drug addiction in my family. Sometimes being around your family is the issue. So there's two things that you're dealing with. And so that's why I'm saying we have to come together and think strategically that, okay, there's mental health, there's opioids, substance abuse, there could be a domestic violence situation. There's all these different facets. So we can't say they just shouldn't be doing this on the street. And you just can't say that. It's a holistic approach that has to be taken because there are so many factors, and especially when they have kids involved, right? So I'm just saying that from an empathetic space because it's not as easy as what people think.
It's
right.
It's not.
So
It's not. No, thank you. Thank you for being here. Mr. Kilborn, anything else you wanted to add?
Yes, I'm biased because I was homeless for 26 years and I grew up that way. And I was really fortunate to find a community organization that believed in me back in Kalamazoo, Michigan, that assisted me with a GED, with social services, with another organization that assisted me with housing. Housing was the biggest thing. Housing was the greatest challenge. And that's back when rents were $400 a month. Now we're dealing with something astronomical. And I could put my phone on the edge of this podium, and all it takes is a little car repair, a medical bill, you're late on rent. This represents the portion of the county in the poverty rate that falls off into homelessness.
Yeah.
Somebody needs to be there to catch them. And I'll say that because I do believe that it's a rare thing that you'll find people who are out in the streets who aren't from here. A lot of people are from here, or at the very least, they're from the region. And so many of our people are 46360 and 46350. And it's important that we take care of them. So I would say we look at people as a part of our community until we know otherwise. And then once we know otherwise, maybe we need to look at them as a part of our community as well.
Right. No, thanks for being here. And then as you're making progress, remember you mentioned about some of the collaboration you're doing with Salvation Army about telehealth for
Yes.
the unhoused. You can please come back to the city council, share that information, how we can refer individuals for those services.
You have my number.
Okay, great.
All right.
All right. Thank you very much. So, this we wanted this to be a listening session, and I know a lot of you have taken your valuable time to be here this evening. So whoever wants to come up here and share some, everybody has about 3 minutes. So if you have any solutions, we know that there is a problem. I think what we are looking for is solutions, and Kelly is taking notes. So we are going to review all these ideas that you're going to share with us tonight. Please go ahead.
Okay.
Yes.
Yeah.
Oh, sorry.
Yeah, no, Mr. Chairman, and if we could, because I said I had to leave
Yes.
a little early this evening, that after Tommy gets done and the young lady up there,
Right.
that the information from the not-for-profits on the amount of people from Michigan City they use the nonprofits. If the nonprofits could come up here and just give us those
Give
numbers.
us, yeah.
Yeah.
We'll let you go first, and then whoever is representing nonprofits, you please come up, and then we would like to listen from you first, and then we'll listen from everybody else. Tommy, go ahead.
Yeah, this is Tommy Kolovic from 1316 Ohio Street. Solution number one to cut down some of the vagrancy in the downtown and northern blocks of Franklin Street. Mayor Angie, you need to have Andy Sciat remove all the 120 OV electrical outlets they have along. I think they used to plug in the Christmas trees into them. The vagrants, they'll be sitting up there, and that's where they charge their cell phones. It's gotten to the point where I can't even sit on my front porch on Ohio Street. I live on a busy thoroughfare. I've had them come walking to me. They want to hang around my house while they charge their cell phone. There's another one that comes up and asks my 82-year-old mother if she wanted to take them out for coffee and all this. So it's another thing. Hate to beg to differ with the chief worker, but the Michigan City Police Department does absolutely nothing about the vagrants. It's been going on for years. The vagrants, they used to camp out in the back of the U-Hauls that they ran a Lucky Stop. Tony Deke would tell Tanya, called the police. The vagrants are sleeping in the back of the U-Hauls. Tanya would call the police. She'd tell the police, well, the vagrants they're sleeping in the back of the U-Hauls at Lucky Stop. The police would respond to Tanya. Now the Michigan City Police Department have more important cases to handle than to go out to shag off the vagrants that are sleeping in the back of the U-Hauls at Lucky Stop. So they're not going to do nothing about the vagrants. They're both passed away now. The other thing is about the panhandling. There's also state statutes that prohibit panhandling. You can look any of these up. This is Indiana Code 35-7-2, panhandling, Class C misdemeanor. It's prohibited to panhandle 50 feet from a monument. Mayor, I make a proclamation declaring the whole corporate city limits a monument to Warren Jones. Is anyone here from city? A person who knowingly intentionally does the following panhandling commits a Class C misdemeanor. Panhandling when the individual is solicited at a bus stop, that happens all the time, in a vehicle, a facility used for public transportation. There shouldn't be any any soliciting it's a South Shore station. And a motor vehicle is parked on a public street or alley unless the person soliciting the individual has the approval to do so by a local unit of government. Has the jurisdiction over this public street or alley. I know the Salvation Army, they're going to go for the Board of Works money, and that's to do their annual donation drive at 420 and Franklin Street. Well, my Pop Warner boys, we've been denied for that in the past, so I don't know why you're going to allow that. 50 feet within an automatic teller machine, a bank or a financial institution. It's prohibited to solicit anybody waiting in line to get into a public a place, like if you're going to a show or a concert or whatnot. You can't panhandle 50 feet from a restaurant. You know, they mentioned the ones that you said it's okay for them to stand outside the entry at Walmart. You know, they're 50 feet from Denny's. So, you know, there's really nothing they're going to do about it. That's my feeling on it.
Thank you very much. Yes, ma'am.
Hi, my name is, can you hear me?
Yes, please.
Hi, my name is Danielle Corley. I'm president of the Veterans Commission that we just got going again this year in Michigan City. And homelessness is something that's close to my heart, not just because I'm a veteran and work with veterans, but it's not just people that are out in the street that we have to consider that are homeless. A homeless person is anybody that lacks a fixed, regular, adequate nighttime residence. So they may not necessarily be on the street. They may be couch surfing. They could just be going from hotel to hotel. So it's not just people that we're seeing on the street. And I think other things that we have to look at, again, is like someone else was saying, lack of affordable housing, poverty, and then the wage, minimum wage, what the minimum wage is that something that's sustainable for someone to get housing, maintain housing, and then take care of everything else that goes with that. Job loss, health emergencies, whether that's physical or the mental health emergencies that the gentleman from the Swanson Center was discussing, domestic violence and substance abuse. As a veteran and person that helps, I'm a service officer for veterans through the American Legion and the DAV. One of the things I think the organizations do need to ask, if they're not already asking, is that person a veteran? Because like the mayor was sharing, there are a lot of resources available for veterans that are homeless. So if they ask that question, they don't even need to be in the VA health system. They could go to Jackie Walorski or Adam Benjamin or Jesse Brown if need be, and go immediately to mental health and be put into the system. And then they also have HUD-VASH available at those facilities. So they may not necessarily get housed here in Michigan City, but they'll get assistance because there's a lot, like I've helped a lot of veterans and pushed a lot of veterans in the direction of getting help in that way. And another thing, I've been reaching out to different organizations like the Swanson Center. I think we did what was it called? Like a crisis mapping for suicide. And I think Jocelyn from Social Services from the police department, she was also a part of it. And so we've also been trying to collaborate so we could work together to figure out how we can help it as a whole. Because when you consider 164 people for the year, and the population of our city as a whole, that's a very small part of our population. And I think we need to demonstrate compassion. Please demonstrate compassion, because like the representative from Swanson Center was saying, a lot of us may be just one paycheck away, one hospital bill away. So please just be compassionate to your fellow person, because you don't know what caused them to be there. And that's it.
Thank you very much, and thanks for what you do. Any other nonprofit organizations represented here? We'd like to listen from you first. Yes, please. Any ideas for solutions?
How you doing? My name is Donnie Allison. I'm a national certified peer recovery coach. Daytime at the Swanson Center, and I'm also the founder of Where We All in Recovery Cafe. And we do work with other collaborating partners. And what we do the whole holistic. I work hand in hand with Harry, Stepping Stone, all the other partners around. And I think that's what it takes, because we all in this, enough people out here for all of us to provide help for. And what we do with the Amber House, we provide the holistic. We try to help them with the grief, because I'm in long-term recovery myself. I'm a former addict. So I know the depths of where my addiction took me to, but it also affected my family, my kids, everybody. So that's what I think that can be part of the solution. Once we get them placed in a housing, then to begin to work on some of the trauma that's leading to making you have to go back to depression, mental illness, substance abuse, and all the things that's connected to this. So I think that I can honestly say, since being in the position with working with the community, because I'm out here with the community, boots on the ground, with them, and we are headed in a great direction. Do we still have a lot of room to go? Yes, but we are out here. We are out here trying to make a difference. And I always like to say, it's always our problem until it becomes your problem. So it's just more of the empathy, more working together, more connecting, and the resources that's out here. As they said, let's bring them all together. All right, you offer housing, you offer substance abuse, you offer mental health, you offer domestic and violence. So now when we're doing the intake, if we can't provide the service, we know the partners to send them to. And I do think that we can move in a great direction as we continue to work as one. Thank you.
Thank you. Yes, sir.
Good evening. Harrison Holtkamp, Nest Community Shelter. We offer emergency shelter in LaPorte County and especially Michigan City. So you guys were asking about numbers.
Yeah.
Last year, we did 330 individuals who came through our doors. Men, women with children. About a 40% recidivism rate. Let's make it easy for math. We're going to say 33%. So that's 220 individuals who came through our door, unique individuals. So they're in Michigan City. So when we're breaking those numbers down now, less than 10% are not from LaPorte County. Up until this January, there was only one shelter in the county, So we took everybody from the county. So all these people, less than 10% coming from the county, coming from outside of our county. Now, we also help individuals who are in recovery, working with our recovery coaches and our teams and such like that. So it could be lots of individuals, lots of organizations coming to us saying, you know, I have this person, can you help them for one night while we get them in? That still counts as a unique individual, whether they stayed one night, whether they stayed 100 nights.
So you have a facility in Michigan City, and now you have a facility in LaPorte.
LaPorte is a wintertime emergency warming shelter.
Okay.
Yep. So it's only a 6-month winter shelter, like what we ran in Michigan City earlier in the 2000s.
Okay. Okay. Do you have any solutions to address this problem?
I think what we're doing now
All right.
is what I've always wanted, is the step to solution,
Okay.
is the collaboration between city, private, all of us coming together. I really think that this is what it takes. And it takes caring individuals like everyone in this room.
Yes.
You know, we all care for our people.
Right.
We do. Whether we're calling them vagrants, which I really don't like, I'd really like to call them people.
All right.
You know, we just need to care for our individuals.
Yeah.
Here nor there, though. So we're here to help individuals. We're hoping we can help you guys. But I think that this collaboration coming together, I think this is wonderful. I really, really do.
Mr. Holcomb, what is the capacity of your facility?
Our facility on our men's floor can hold 30, and on our women's and women with children floor, 20.
Okay. Do you have situations where there are more people than what you can accommodate?
You know, what's really crazy is this year we've seen numbers where we haven't seen before. And I've seen a larger population in the summertime than I do right now.
Okay. All right.
Which isn't the norm.
Right.
Yeah.
Any questions from Mr. Holcomb? Yeah.
All right.
Thank you. Thank you very much. Any other non-profits, please?
Hello,
Hi.
my name's Amber Crane. I'm with Amber's House, Inc. here in Michigan City, Indiana. I am the executive director of a residential living home for women seeking recovery from drugs and alcohol. We can house 9 women in this home, and we have 6 in there currently. 4 out of the 6 are LaPorte County residents at this point in time. I just want to say, I came to a city council meeting a while back, and one of the council members said something that stuck with me and always will. And it was, be the change you wish to see. And that's what we're lacking as a community. I think that in order to change, we have to have action. And so the small community of people that are helping these people that need help, we can only do so much because there's only so many of us. So I'm grateful for those that are out there staying up all hours to help those that need it. But we need more people to be the change. That's just what the community needs.
Right. Thank you. Thanks for what you do. Yeah, please go ahead.
Good evening, everybody. My name is Jim Musial. I'm the Executive Director of Citizens Concern for the Homeless. And in Michigan City, we operate Sandcastle Shelter for Homeless Families, the Keys to Hope Community Resource Center, which we built 10 years ago. Sandcastle has been around 34 years. The Grace Learning Center, which I'm going to talk at length a little bit about today, and the Food Rescue Initiative that we took over in 2019, and we do the mobile events and food rescue. Talking about the numbers, Sandcastle Shelter has 7 rooms for families, and we generally, on the average over the years, will house maybe 25 to 30 families over the course of the year, about 130 to 150 individuals. But 95% of the people that stay at Sandcastle Shelter are from Michigan City. Keys to Hope, on the other hand, it's about 50-50. 50% of the people that come through Keys to Hope are from either 60 or 50, LaPorte and Michigan City. The other 50 are from outside of there, but none of them are from outside LaPorte County. Okay. Now, both of those programs work under one common theme, and that's when an individual comes into our shelter or an individual comes into our resource center, we sit down and we have an intake conversation with them. We talk about where they're from. We get all the figures we're obligated to get from the federal government, from the state government for getting state money, and we keep for ourselves locally. During this conversation, we find out what their barriers are. We talk to them for a good hour, sit down and check off all the boxes, do that, but then have the discussion. And at Keys to Hope, more than 50% of the people that go in there suffer from either mental health or substance abuse. Getting the numbers, and thank you from Kath for providing this. He spoke about it earlier, and I have it here. No, I'll have to come back to it. The numbers are even higher for people that are out on the streets, that they're reaching out on the streets. Once we know what their barriers are, we sit down and we develop an action plan. We're talking about the community action plans. This is our individual action plans for each family. There's no cookie cutters. Everyone's different. Everyone's unique. So we decide what their barriers are and then how they're going to address it. Some of the people come in and they are paycheck to paycheck people that generally have their stuff together. You have other people that are generational or have been struggling for a while. They come in without vital documents. They come in without anything. We have to start from scratch. But we quickly identify if their problem is monetary. We determine whether or not they have computer skills where they can navigate different systems and find out where they need to go. But again, the vast majority of the people that come in, they have mental health and substance abuse issues.
So basically, you have like a case management program. You identify what their barriers are, what their resources are, and where they can be plugged in.
And what we're going to do it. And that's where Grace Learning Center comes in. Grace Learning Center was built in 2011, so it's been operating for a while now. And it started out as a GED education center for the West Side. It was going to supplement what A.K. Smith was doing in the evenings. That was an epic fail after about a year. And in 2013, we started building different classes that we work with in collaborations with different organizations in the community. Goodwill Industry comes in and teaches basic and intermediate computer skills. You have Work One that comes in and runs a series of different job readiness workshops and seminars. You have PNC Bank right now that comes in and does banking, budgeting, and credit repair. Then we get to the meat of it. The biggest problem that we have, substance abuse and mental health. We started about 4 years ago with these programs. We partner with Pillars of Wellness out of Maryville. They teach 4 different specific classes dealing with trauma. Everyone that comes into our building or Harry's building or Stepping Stone comes in, have suffered a trauma, every single one of them. So we have a class designed for dealing with trauma, healthy relationships, self-esteem, and kind of a potpourri living with anxiety, depression. And they do this through Pillars of Wellness. Now, Pillars of Wellness will also work with each of these individuals one-on-one if during the class it's determined that they need some more assistance. A contract was provided to me today to sign that they will be providing us with evaluations, on-site evaluations in person with the people that come through our community. Now, this particularly, what I'm talking about is for our participants, but as a community benefit, the 4 mental health classes that I talked about, trauma, healthy relationships, self-esteem, and the living with anxiety and depression are live streamed. We have hyperlinks on our Facebook page, so anyone in the community that has a smart device and access to the internet can tap into these classes and watch them. We deal with health and wellness. We have, and we work with just dozens and dozens of community partners that bring in these things. So our solution is try to pinpoint exactly what their problems are and then get them over to Grace, or if extreme, work with our other community partners and refer them out. This has been a very effective way for us to deal with the problem.
How can people help you? You're a non-for-profit. Do you solicit contributions from the community?
We live in a very, very generous community. We do. 20% of our money that comes in through community contributions, individuals, churches, corporations, organizations. About 80% of the money that comes in comes from grant funding.
Okay.
We get money from HUD, So we get money from the federal government under the ESG programs. We get money from God, I'm thinking right now. I'll come back to that. But we get the state funding through those two programs. We get state funding through the Indiana Department of Health to run our health initiatives. But primarily we get really good support from the community. The city with CDBG funding has helped us tremendously, not only with each of our individual programs through HUD money, but also through the programs I was talking about, mental health and substance abuse. For the last 4 years, they found money for us out of the Coronavirus Relief Act. So we're very appreciative for that.
I'll ask you one question.
Please do.
When you have facilities like yours, why do some individuals stay outside on the street and not take advantage of facilities like yours and then try to get into proper housing?
Why they won't come into our facility?
Right.
You'd have to ask them that. But
Right.
I think, and personally, this is my opinion, a lot of them have become comfortable in their uncomfortable situations.
Okay.
And I think Mike spoke to that. And a lot of the people have these mental health issues. That's why we rely on people like Mike and Jennifer, and they come into Keys to Hope. They hold office hours there twice a week for a couple of hours, and they're out on the street working with these people. And Mike can tell you, he'll go out to them and they just won't come in because of that. So it's not that they're being kept out. A lot of the people that come into our programs, we service at Keys to Hope, 350 different individuals a year uniquely. And a lot of those people will come in for a little while and leave. A lot of those people want to be able to drink with impunity or go out and solicit,
Thank you.
panhandle.
Thanks for coming. I appreciate your input. Yes, ma'am.
Hi, my name is Kayla Riley. I'm the executive director at Stepping Stone. We service individuals who are fleeing domestic violence, sexual assault, or human trafficking. We have a 24-hour crisis shelter, and we also have transitional housing that is specific to survivors. And we also have non-residential services as well. We work alongside a lot of the same people that are in this room every day. I feel like we all partner together pretty well. In 2024, we serviced 210 in-shelter clients. And right now, we're going to surpass that for 2025 for sure. We're averaging about 200 crisis calls a month. We can't share locations because we can't sacrifice survivor safety for the sake of appearing more productive for any one place or anything like that. But I do respect the need to know. We do prioritize LaPorte County, but oftentimes people come from other places or they're fleeing or things like that. I mean, it is people's lives that are at risk. So we're doing like a lot of what these same people are doing. We are working every day tirelessly to make sure that survivors have safety and they can heal as much as they can.
Right.
So thanks.
Thank you. Thank you. There is one site, One Sound City at the school tonight at 7 p.m. So we'll wrap this up at 6:30. We have another 15 minutes. If anybody has any other solutions, any ideas about solutions to address this problem, please come up. Yes, sir.
Hello. Ray Maloney, Michigan City resident for 6 years.
Yes.
I'm with my colleagues from the Michigan City Conservative Action Group. We meet every Thursday at the Sugar Bowl restaurant to talk about solutions. It's the same thing you're asking for right now.
Right.
Some of what I'm going to say might not sound compassionate, but I heard what Angie, the mayor, said about having to see someone go and get turned away and wound up overdosing. And I think that's tragic, and it affected me to hear that. I have mental health issues in my immediate family, so I try to be compassionate. I think we all do. But one thing I don't hear talked about, or maybe I just didn't hear it, was a permanent exit for homelessness. What's our plan to get people permanently out of homelessness? and into a productive life. I think that should warrant a lot of our efforts and attention. I also want to know, is it true that we just recently quit charging people for bus rides in Michigan City? Is that true? So the buses are free? So from my standpoint, that is a disincentive for people to come here and encourages homeless people to come here when they know they can ride buses for free. That I don't think that's a good idea. There's a lot of issues with spending right now that I'm against. I'll give you one example of the wheel tax. We just implemented a wheel tax for residents of Michigan City, and LaPorte County did something similar. I'm against that. I think we talk about one bill could spiral somebody into homelessness. Well, maybe it's the wheel tax that takes away a vehicle from somebody who uses that vehicle to get to work. So I think that tax is counterproductive. It's penalizing the very poor people that it's probably trying to help, but maybe it's not doing it intentionally, but it's a bad piece of legislation. I think another thing we need to do is look at property taxes. So we talked a lot about family and its impact on homelessness. So property tax, think about the senior living in their home and their property taxes are going up and they can't afford it. And that senior happens to have their grandchild living there too. And perhaps that senior has a niece and a nephew. And all of a sudden that senior says, I got to sell the house. So what happens to those people that are living there? Could it be that they wind up homeless out on the street? It's something to think about. We've, as a group, the Michigan City Conservative Action Group, we are recommending a cap for seniors and those on a fixed income, seniors age 65 and above, in their home that has a primary homeowner's exemption. So cap their property tax. And
Sir, it's 3 minutes are up. Here's what I would say. You have brought up a lot of important issues, and we will address it at a different time, but we'll focus our attention on homelessness right now. And I know you brought some issues about property taxes and all, but we will address that.
Okay.
Thank you very much. Yes, ma'am.
Hi, my name is Sandy Keller, and I am here representing a nonprofit, Homeward Bound Villages.
Okay.
And most of you are familiar with our work. You've
Yes.
with funding for our project. So I want to share a few things about the work and some recent happenings that really help you understand the unhoused community and some of the challenges that they have, but really have some solutions that I want to pass on in a
Yes.
document that I'll leave you with. So someone described earlier the definition of homelessness, and just to kind of recap that, it's someone who does not have a permanent home. So while the statistics, might see people on the street, count people on the street, there are lots of people that are in that situation. If you follow state and federal cuts and policy changes, you should anticipate that the problem is going to significantly worsen. What was really fascinating in the process of us leasing up and opening up our first phase of Homeward Bound Villages is looking at applicants, looking at income, understanding the significant number of people, whether they're young or old or somewhere in between, that are trying to survive on about $1,000 a month. And just imagine trying to do that with the rents today. We have 2 individuals that have been housed or will be tomorrow that are currently unhoused. And while that's only 2, right, it is a start. And it really gets down to availability and affordability. I promise you, there is no one living outside that prefers that. But there are needs that they have for housing and desires they have. And a shelter is not considered housing. It's a bed to sleep. It's not that permanent place to live. So what I do want to share is I really appreciate Mayor Angie talking about looking at Bloomington and that looking at how others are succeeding is really a great place to start. So I want to share about a program, or a little bit different than a program, called Beyond the Bridge, a solution to homelessness. This is an impact campaign that is across the nation. It is two film individuals that actually are Indiana natives, and they started or created a film showing a couple cities, large major cities, that are succeeding with their solutions for homelessness. And some cities you'll recognize that are on the list that have already done the film screening and starting down their path of solution are Indianapolis, Lafayette. One for Anderson is coming up. Indianapolis started implementation of their program over a year ago through their Coalition for Homelessness Intervention and Prevention. And I think that's really key, right? Everything that was talked about today is kind of on the, like, what are we doing when they're already unhoused? But what are the solutions that are going to get put in place to really help prevent it? And it really does rely on housing first strategies. I would encourage you to really deeply understand housing first. You will hear, and should be hearing now already, about policy shifts in Washington that are moving to decades-old and unsuccessful approaches about criminalizing, about first expecting people to get treatment before they're housed. And there is massive amounts of data for housing first to succeed and its proven results compared to the shift in policy coming out of Washington.
Skylar, I want to thank you. I think your time. Can you share that information?
Yeah,
Because
so
you can
leave this with you so you have a little bit
leave
of
it with us or email it, because we would like to definitely.
You know, as Harrison and others have said, the broader the community is involved that cares about the solution and maybe even moving outside of just the city of Michigan City, there's lots of folks in the county that come to Michigan City and Michigan City folks that go elsewhere. And, you know, a lot of people that could work together on those. So
We'll do that.
Thank you.
We'll do it. Thank you. Thanks for coming. Yes, sir.
Hi, my name is Michael Andrews. I'm at 627 Donnelly Street here in Michigan City. I have been a resident for 15 years, okay? And in that time, I have rented, all right? One of the problems I think that a lot of people are talking about but aren't really addressing is their point of view. Why is, you know, that situation happening, okay? When I first came here, the only reason I was able to come here was because I was able to find affordable housing. Okay. Now, in the last 4 years, my house has increased 104% in 4 years. You can't touch a home here for less than $100,000 that's actually livable. Like you can actually go in and move into it. Okay. I don't understand why people can't get a plot of land, put tiny homes on them. Like literally, like they're like reused shipping containers for like $2,000 or $3,000 and a small piece of land that they own because they're tired of being told what to do from all these organizations that they're supposed to be going through, right? For all this help. I was always raised to believe that when you help somebody, you do it willingly without asking for anything in return. I understand that there needs to be boundaries, but if you give them an opportunity for something affordable, they'll do it themselves. They will go out, they'll work 6 months to afford a home that you price tag at $10,000 to $15,000. And the greatest part about that is you're going to double your money doing it. It's an affordable, reciprocating program that blows me away that I don't understand why people aren't even looking at that. They need their own homes.
One of the solutions you're proposing is to make the homes affordable and small enough because everybody doesn't need a large.
Nobody. I mean, I don't think half the people need what they need. They need what they want. These people
That's
just
one
need
of
an
the
option.
solutions. One of the solutions that has been proposed. And I'm so glad you brought that up.
Thank you. I'm going to leave what I wrote right here, but it's a sustainable, self-sustainable. You don't need donations. You just need to do the right thing.
Right. Thank you. Thanks for coming and sharing your ideas. I appreciate that. Yes, sir.
My name is Bill Fennell. I am the food rescue coordinator with Citizens Concerned for the Homeless, and my office is at Keys to Hope. So I'm somebody who's there on a daily basis. I'm somebody who answers the phones daily to incoming calls, people seeking shelter. I can tell you, we get out of state people, out of county people calling on a daily basis. And then the first, second, third question I have for them is, are you a LaPorte County resident? If they're not, I have to stop the conversation with them and tell them we don't have the ability to serve them. There's some tension, I think, with some people about the services we provide having us here, which if you look at Keys to Hope, 40 people a day on average, we are serving. If you look at Sandcastle, they currently have 7 families, including 17 children there. If you look at the number of people that are Stepping Stone at Amber's House, we provide services to a lot of folks that keep them off the street. Does it attract other people because we have good services? Yes. But look at the value we're putting out when we are here. I think that something that everybody here needs to understand, and it's been said, but I think we need to look at it broader. It's not just a Michigan City problem. It's a state problem. It's a federal problem. We don't have a comprehensive state mental health program. We don't have comprehensive federal level program. We have a mental health system that is overwhelmed. When somebody comes in today and they need a mental health evaluation, it may take 6 weeks before they can get in front of somebody. So then that causes a problem where we have just a cycle of individuals who are mentally ill or mentally challenged are going to the police, going to the hospital, going to the jails, going to the shelters, going through on the street. And they keep staying in that circle until we can get funds to get people out of here. We need more money for beds for the mentally ill. We need more places for the mentally challenged. If you're a mentally challenged person, there's a wait list of 2 years to get into one of those group home programs. We also need to look at what's going on in LaPorte at the trustee's office in LaPorte. Lisa Pierzakowski there runs an amazing program at the trustee's office. She gives them, she has the ability to have laundry facilities, a shower. She has a food pantry there. I think we need to figure out how to get our trustee's office to get a similar program. And I also want to point out, when we talk about getting people out of the cycle, I can tell you there's several people in our program that told me, I was introduced to by my parents to drugs at a very early age. I was in shelters at a very early age, and they're still in the system. They can't get out. So we need to figure out how to break that. And I also want to mention, we do have limited funds available. We have a rapid rehousing grant program. We are able to assist people with first month's rent or security deposit through a grant that we received. So if they need information on that, they can reach out to us.
Thank you. Thanks for everything you're doing. I appreciate that. Good ideas. Anybody else? I wanted to conclude by saying this. We are grateful to all of you who have been here today, sharing some of your ideas. And I know, Elizabeth, you're still there. Thanks for joining us via Zoom. And our work is just getting started. And ultimately what we need to do is we need to find affordable housing so that we can get them from where they are to where they need to be. And there are many solutions to it. One of them is, like this young man just said, build smaller homes, give them land that they can, that way they are self-sustaining. I think to make them independent and self-sustaining is very, very important. But I think mental health issues are extremely important. So we're going to continue to work with Swanson Center for that. I know Major Becky was here from Salvation Army. She had to leave. So we'll have to come together as a community, bring all these organizations together who are in this area of helping those who are unhoused or homeless and getting them back on their feet and getting them off the streets. Because ultimately, if we get them off the streets by getting them into permanent housing, That's the best thing that can happen to Michigan City. So we'll be open to all the ideas that'll be coming forward, and we are going to meet periodically to address these issues, and hopefully we'll make some progress and in the months and years to come. With that, let me just turn it over to Councilman Moldenauer. Any idea, anything you wanted to share before we conclude?
I think many excellent ideas came forward, and I especially really appreciated hearing about the Beyond the Bridge program. That's one that I actually had not heard about, that Sandy Keller from Homeward Bound Villages introduced to us. I think it's going to be a multi-pronged approach, and it's going to take all of us, our commitment in our heart and our resources. Thank you.
Councilman.
This was very informative. I learned a lot from you all. And I know some of you and worked with some of you in the past, but I'm more than happy to work with more of you and partner with some of you. A small thing I can offer, in regards to shoes. I have a care closet at Barker Middle School, and I already partner with a few of you with that. But if anybody ever needs shoes, I have hundreds, if not thousands of pairs of shoes at Barker that are all washed and cleaned, and they are winter boots or dress shoes or sneakers. So if anybody ever needs anything, please reach out to me, and I'm happy to have you come in and get shoes for whoever you need at any time. So thank you all for being here.
Thank you. And one last thing I wanted to mention for the gentleman from the conservative group. I also believe in getting people to become self-reliant. You know, our ultimate goal is to make people become self-reliant, but to get them from where they are now to get to where we want them to be self-reliant, it's a journey. And it's going to take time. But as a philosophy of my personal philosophy, I'd like to see everybody become self-reliant. So I appreciate your participation and you being here this evening. So thank you all for coming, and we'll continue this conversation. And I'm going to work with Mayor Angie. She's planning to put this group together and come up with some action plans to address this problem. Thank you and have a nice evening.